Welcome, everybody, to our October meeting of the Community Advisory Council, Central Oregon's Health Council. We're going to get started with a land acknowledgement, which is Stacy's going to read for us.
Thank you. We we recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Willamette, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Thanks, Stacy. For anybody who's new, we do have some slides that kind of explain our meeting practices, but generally we want to make this meeting welcoming for everybody. Eliminate as much of the lingo and acronyms as possible. Keep our language pretty simple, and speak in turn. Respect each other, and make progress through our agenda. Get our work done. So with that, we're going to do introduction. Actually, Michaela, you had a announcement of some new staff changes.
Yes, I do. So the Health Council is going through some transitions, and we have some very bittersweet news to share with you all. Some of you may have heard, but our Grants and Metrics Manager, Rebecca Berry, has moved on to a new role with the Roundhouse Foundation, which she will continue to serve and support our Central Oregon communities. And her last day was on Monday, October 17th, so a few days ago. And Rebecca has been with the Health Council for about 7.5 years. She has led the region through the Regional Health Assessment and Regional Health Improvement Plan process twice. She's led work groups as a project manager. She's developed our grant platform and spearheaded and developed the data website, and also created the impact incentive funds. Also, Renee Worth, project manager, is following her passion and pursuing a doctorate in public health at the University of Illinois. And so she has stepped back from her current role, and she has worked tirelessly with the work groups and committees and built out the community grant and review process for both the mini grants and the standard grants. She's supported community partners in their work with the CDC grant and has championed and guided work for CODI, which is the Central Oregon Diversity, Equity, and Inclusion Committee, and their action plan, and the Central Oregon Health Council commitment to diversity, equity, inclusion, and justice statement. So we are very grateful for both Rebecca and Renee's time with us. Also, we have some good news. We would like to welcome Miguel Parada to the Health Council team. He is a familiar face here at the CAC, and he will be stepping into the project manager role and helping to lead and facilitate our many work groups and committees. He brings many years of diversity, equity, inclusion, justice, and community engagement experience. So welcome, Miguel. Yay. Thank you, Miguel. And additionally, we'll be welcoming Whitney Schumacher to the team at the end of November. And she brings experience in public health and education, specializing in community coordination, group facilitation, and grant writing and data. So we are excited to welcome them both on the team. And we welcome your patience and support and understanding through the end of the year as our small staff navigates these large transitions. And so please watch an email for additional information of who to contact in Rebecca and Renee's absence.
Thanks, Michaela, and a huge thanks to Rebecca and Renee. Y bienvenido a Miguel and Whitney. So let's go ahead and for those of you who might be new to our CAC meetings, we do introductions one by one of our CAC members, and any guests and or people who are in new positions. So if we could go ahead and move through that. And Kelly, can you help us?
Yeah, so we'll start with Brad and then Elizabeth.
Okay, I'm Brad Porterfield. I'm the chair of the CAC and a consumer representative, and also the executive director at the Latino Community Association.
I'm Elizabeth, and I'm the vice chair of the CAC, and I'm a retired voc rehab counselor who got sick and became a patient. So that's how I got into being a CAC member. You know, it's a long process. Thank you.
Connor and then Mandy.
Hi, I'm Connor Carlson. I am a CAC member and I work for the Family Resource Center of Central Oregon.
Hi everyone, Mandy Seeley. I am a CAC consumer rep and I am an advocate in Sisters.
Maida, then Natalie.
Hi, everybody. My name is Maida Benitez. I am a CAC member, and I also work for a Family Resource Center.
Natalie, I think we're having a hard time hearing you.
Can you hear me now?
Kind of. That's Natalie, everyone.
Is it okay to put on the chat?
Yeah, that would be great. All right, next we'll go Teresa and then Elaine.
I'm Teresa Lender and I'm a community representative on the CAC.
I'm Elaine Fischel, pronouns she, her, hers. I am a community rep on the CAC and with Mosaic, I'm the director of strategy and development.
And Miranda, then Stacy.
Good afternoon, everyone. My name is Miranda Hill, pronouns she, her, and I'm a CAC member and I'm with Klamath County Public Health.
Hi, my name's Stacy Shaw, she, her. I am a CAC member, a community rep, and also Crook County Public Health representative and regional overdose prevention strategist.
And then we have Ariel here today. She's here for Caroline, correct? If you want to just say hello.
Hi, everyone. Can you hear me?
Yes.
Perfect. Yes, I'm Ariel Salgado. I'm the Outreach and Education Coordinator, just like Carolyn, for the Oregon Health Authority, the Health Insurance Marketplace, and I'm going to be covering for her. She is a CAC member.
Great. Thank you so much. That is all of our CAC and guests for today.
And how about, since Miguel, you're new, you want to go ahead and introduce yourself, even though you were introduced, but you hear your voice.
Thank you so much, Brad. So Miguel Angel Herrada, new project manager here. And I think I've seen some of you doing presentations. I worked for Pacific Source during 8 years, and I'm so happy to be here with you in this new position. Thank you.
And then just one more person, because I noticed Carmen, I'm pretty sure this is the first time you've joined us at a CAC meeting. You want to introduce yourself? No? I have that wrong?
Sure. Hi, everyone. I have been here, but have been busy also. Carmen Madrid, she, her, hers, Executive Director for Central Oregon Health Council.
All right. And then for those of you who didn't introduce yourself, just so you know, it's the one way we found to keep our meetings on schedule, because we're just always short on time. So it's not to slight you. It's just a way to save a little bit of time. So with that, we're going to move on to public comment. Is there any public comment? Going once.
So can I make a public comment? Yes.
Go ahead. Yes. Yes.
Our team, our community health workers at Mosaic for both Medicaid and non-Medicaid members have been really stressing with medical transport. And I just want the whole CAC to know that I now health council staff about that. If we could get that on the agenda soon, it's a huge access barrier for healthcare and connection, and I think it was talk about.
Is there anybody, Elaine, you're kind of muffled and I didn't understand. I apologize. I didn't understand your point. Did others hear better than I did? Can somebody reiterate what Elaine just asked us?
Yes. Sorry, can you hear me better now? My paper was, no?
That's a little better.
Okay.
Yeah.
So just medical transport is even more of an issue right now than it was a few years ago. And just wanted to make the whole CAC aware that I've brought this up with the Health Council staff. If we could get this on the CAC agenda, and we have a community health worker at Mosaic, actually, who used to be on the CAC, Regina, with Cook County Health, that is very passionate and knowledgeable about this subject for Medicaid and non-Medicaid patients. And this is a community issue that we would like to rise up.
Okay, is Regina with Mosaic now?
Yes.
Oh, cool.
We're very lucky.
Nice. Okay, any other public comment? Thanks, Elaine. Any other public comments? Going once, going twice. Okay, let's move on to CAC members. Is there anyone, I hope everyone's had a chance to review the notes from our September meeting. And this is the time to speak up if you see any problems with those notes. Is there anything that needs to be changed, added? Those notes should just reflect accurately what took place at the September meeting, any decisions that were made, not every single comment, but kind of a summary. Anybody? I'm just gonna, we'll approve those notes as accurate unless somebody speaks up with something you'd like to see changed or a question. Okay, we can approve the notes, September Community Advisory Council notes, meeting notes. And with that, I'll turn it over to Michaela. We're going to get on with our community health project.
We actually have a quick breakout room just to kind of get you warmed up and talking before we head into talking about the community health projects. Okay. So Kelly, would you mind sharing what the question is today?
So today we have something, hopefully a little bit more fun than our serious conversation we're going to have shortly. But do you believe in ghosts? It's that time of year, Halloween, all that fun stuff. So I will put you in breakout rooms, and we'll do a shorter one today so we don't take up too much time. And we'll see you in maybe about 5 minutes. Okay, everyone's back.
That was fun. Okay, let's turn it over to Michaela.
All right, community health projects time. And just for any guests, so community health projects are community level projects that focus on addressing social determinants of health and health equity. And this group is in charge in investing this year a little under $2 million into the community. So congratulations, everyone. You made it to funding decision day. Whoop, whoop, yay. But I do want to say from us at the Health Council and your community appreciates the many hours and thoughtfulness and care that you've put into this. And you this year have received an unprecedented 73 pre-applications to review, which we all know is no small task. And there is actually 4 of you that reviewed all 73 pre-applications. So I want to give a special thank you to Teresa, Mandy, Connor, and Elizabeth. So thank you very much. That was a lot of work and a lot of time. And I also want to give an honorable mention to Stacy, who completed all but 2 batches, but I know our timing with sending out the batches kind of interfered with that. So thank you as well.
I read them, but I wasn't able to respond to every single one like I did the other one.
Thanks. Okay, so before we move on, I want to do just a quick little refresh on the timeline, and then I'll show you how your scores stacked up. Okay. All right. So just a reminder, so today you already submitted your scores for the application. So today is the day to make your award decisions. And we modified the process back in August. So you'll be making your award decisions based on the pre-applications. And then we'll notify all the applicants of your decision by Monday. And remember with that pre-application, the applicants still need to fill out that full application. So they'll be providing more details. They'll have to submit their objectives for their projects, and then also any proof of working agreements with the Confederate Tribes of Warm Springs or any other tribal community that they put into their application. We'll also be notifying those that didn't make it by the 24th as well. And then everyone that was funded will need to submit their full applications by the end of November. Okay. So for your funding decision today, you have exactly 29 minutes to make your decision on investing a little under $2 million. I'll show you the spreadsheet and how your projects lined up with the scoring. Then I'm going to pass it over to Buffy to show how the projects lined up. She did a little adjusting based on a tribal lens for you to consider. And then we'll have a conversation of how you'd like to move forward with funding, if there's any adjustments that you want to make, and so forth. Sound good? Okay. I'm going to share my screen. All right, so this is the spreadsheet that we sent out, Kelly sent out a couple hours ago, and this is just how you scored it. With the spreadsheet along the top, you can see what organization submitted, the project name, the amount requested, and then the individual categories on that score sheet that you filled out, and then the total points, and this is the average points. And then further on the right-hand side are just our notes around if there was anything flagged, around adjustments that need to be made if they needed to be adjusted in order to fit community health project requirements, and any concerns from the tribal piece. So on the spreadsheet, they went from top ranked to bottom. And then we'll show you the line where that 1.9 fell. And then there's projects that fell below the line. And in the spreadsheet, there were some projects out of that 73 that that didn't meet community health projects funding requirements. And so those are down at the bottom. And we pulled those out of the ones that can be funded up at the top. All right, questions on the layout specifically? Okay. And then one important piece to note is that you'll be able to fund the full 1.9, but then Carmen has offered to fund up to, with Health Council funds, for us to be able to fund the ones that fall below the line that can be funded up to 50%. So everyone that met requirements could get some sort of funding.
Just to clarify, do you mean 50% of what they requested or
Yes.
50% of the total? Okay.
Yeah, so 50% of what they requested, up to 50. We still have to play around with it, maybe a little on the back end.
Michaela, this is Trisha Wildner. Hello. This is just an exceptional spreadsheet, first of all. So thank you so much for your diligence in this space, COHC team. Can you clarify what the programs that you just mentioned? Can you scroll to that spot and clarify what those programs are?
Which spot?
The ones that you said could potentially be funded at 50%?
Yeah, so it's line 49 through line 68. So those were the ones that were not flagged.
Thank you for that clarification.
Yep.
And where does that money come from, Michaela, to do 50%?
Oh, I'm gonna lean on Carmen.
Hi, everybody. So this is money in COHC's funding that are unrestricted funds
Oh,
that are
okay.
not tied to these to this effort.
Okay, so it's money that you could allocate almost anywhere based on what you decide as an organization, correct?
Right. I mean, not just anywhere, right? We want to be intentional in terms of aligning it with the work that we're doing.
Right, right. Okay, thanks.
All right. So this is where the line falls with how you've scored it. And I'm gonna kick it over to Buffy to kind of share, because she looked at this through tribal lens as well, just for another option to consider. All right, I'm gonna stop sharing my screen. I believe either Buffy or Kelly, do you want to share yours?
Hello, everybody. I guess let me know when you can see my screen.
We can see it.
You can see it. Okay. So, if you guys remember from last year, when we looked at creating the application to kind of help teach us who's working with tribal nations, who wants to work with tribal nations, and what does that look like, we kind of I made some recommendations for the application. And because this work hasn't been really done, at least with me and this group, it's always a learning process. So out of those changes that we implemented, I was given 19 applications that are, 19 applications that basically indicated that they somehow served tribal spaces. And that was kind of different as far as once I read within each application what that looked like. So when I first got handed this, what you're seeing, and I began to do the work to give you guys enough information about where I could tell you what was actually going on from the tribe itself, from that organization, or from the spaces that they say they were working, and do it in a way that kind of made sense. I kind of began to just kind of take each application and basically try to figure out how to talk about it. And then I made a meeting with Kristen, Michaela, Kelly, and Gwen, and then just kind of literally on a very microscopic level talked about each one of these, because I wanted to always look at what was the strengths of the application, what could be adapted, how do we communicate that to the applicant. And so then I would kind of just make like my questions, my thoughts, or my comments as I read it. So I did all of that. And that's where you see the comments on the spreadsheet, this spreadsheet. So that's where you've seen some of my comments where it was like, you know, hey, is this just simply if you ask them to uncheck the box because in their application, it's really not clear that they are doing what they're saying that they want to do. Or so those were those kind of conversations. So then I got kind of pulled in maybe about a week ago or sometime, I don't know when, to where they finally said, okay, we got the total points from the CAC and how they scored. And so then I said, okay, now we need to pull this through the tribal lens in a way to make sure that we give the CAC enough information that they could be assured that these organizations are really doing what they say that they're doing. So in this case, I just did this simple methodology of taking and saying, okay, there's pretty much on our application, there's pretty much 7 spaces that you could, if I assigned 1 point per it and added it to your guys' score, could potentially increase their application to a different ranking. So in some of these applications, we were faced with the applicant wanting to be inclusive of everybody. So they're not going to exclude the Confederated Tribes of Warm Springs, and they're not going to exclude the citizens of Warm Springs, but their work didn't necessarily mean, wherever, let me find one, that they didn't necessarily focus on the Confederated Tribes of Warm Springs or its society. So for that, I just pretty much said, okay, you know, everybody pretty much gets a point. But where you started to see the difference is as I vetted each one of these applications against the relationships that they said that they were having in these spaces, that's where you began to see the difference between the individuals who were actually inside the community. And in this case, Lions for Life, when I answered over here these questions of being able to say, do they serve tribal members? Yes, the nation, citizens, and communities. Now that could have been 3 points for each one or just 1. So I just said, it's just 1. They do have an MOU and an MOU with the Confederated Tribes. They are serving the tribes. They are serving the community. So that gave them 4 points. So then I added the 4 points to your guys's 46.75, which now gave us a total score of 50.75. Now, for the top, we'll say the top half of this, it didn't really change anything. Where you begin to see the change is at the bottom. So originally, above the line at 43, basically these right here, these applicants, you seen them being at 43.001 and 42.883. But when I made my adjustments, some of them dropped below the line. And some of them from below the line previously went above the line because of the application and because of the ability or because of them saying that they're working within the tribal communities, which they are. Like with Saving Grace, they are literally working with VOCS, which is Victims of Crime services for our domestic violence survivors and their families. And so so then the question became, when I was talking with the team this morning is how do we, in 2023, with the CAC and with all the applicants, how do we begin to teach about the difference between simply wanting to not exclude anybody, but really giving you guys those spaces of people who are really boots to the ground inside that community, so that you guys understand that those investments you're making are making a difference. And I don't know if that makes any sense to anybody, but I'm going to stop and I'm going to let you guys ask questions or react and seek clarification if you need it from me.
Hi, Buffy. This is Brad. My question is, are there still proposals in the approved, the upper section within the 1.9 million and some change that, like said, they're serving tribes but aren't?
Yes.
There are.
Yes.
Okay.
And I thought about it. And so this is kind of, Brad, what I was thinking is that I didn't want to I didn't want to have the feeling of being punitive, like taking away anything or necessarily calling anybody out for saying, you know, you're not doing that. Instead, I just wanted to kind of acknowledge that at least in their application thought process, they remembered that there are tribal spaces. And so until we teach and learn more together moving forward in 2023, I kind of didn't want to be punitive feeling, if that makes any sense.
Yeah, that makes a lot of sense. Thanks.
So would it be helpful, CAC, if we show you kind of how that would shift things and on like how you have them lined up right now?
Michaela, hey, it's Connor. I have a quick question. We're going to invite only those that fall within the funding to complete the full application, or are we inviting everyone to complete the full application?
So we would be inviting everyone that falls above the line to complete the full application for the community health project funds. And
Okay.
then health council staff's gonna figure out that the ones that fall below the line. But for the purposes of today, yes, everyone that falls above the line that will be funded with community health project funds will need to complete that full application, be able to show verify, prove their working relationships with the tribes if their project works with the tribes, learning objectives in more detail.
Thanks.
Yeah.
I need clarification a little bit on working with the Native American tribes, please. So are we as a CAC trying to reach out and create connections that actually are helping and working with the natives population? Or are we just trying to not exclude them? Like, what is our actual, I know we wouldn't exclude them, but what is our actual goal when we're looking towards organizations? How do we know, first of all, what's our goal so we can know if they align with that goal? Or, and then how do, I guess the second part of that is, how do we know it's not just a buzzword, like working with the most vulnerable population, not necessarily natives, but you know, who is that? See what I'm saying? That's way too general, doesn't tell me exactly what they're doing or who they're working with. But I'm trying to clarify, what is our role in creating this connection with Warm Springs and other Native populations? Can you help me?
Yeah, I think absolutely. I think that is the point of our journey together, is trying to tease out, and that is where part of my role is to work with the Health Council, to work with the CCO, to work with the CAC, to work with basically anybody who wants to get to the point where they could say, as a CAC, our priority is 1, 2, 3, where it comes to tribal nations. So what you're seeing right now is you're seeing me having to help you guys know that if you choose to make the investment for Lines of Life, that Buffy has done her due diligence to go to the Confederated Tribes of Warm Springs and ask them, is Lines of Life doing what they say they're doing? The Confederated Tribe says, yes, Buffy, they are. We have a MOU with them. Here is their physical location. You guys have seen the building. You have seen the commitment from the tribe to do that. So see, part of where we're at is that we're relying a little bit right now on my efforts and my boots to the ground to make sure that you guys know that Warm Springs Community Action Team not only is physically there, that they are doing what they say they're doing. So until we get to the point where you guys as a CAC can say, this is what we really would like to focus on, or this is what we would really like to see. And I think that's an evolution that's going to happen in probably, I'm guessing, I was telling them this morning, in about 3 to 5 years, you guys are going to be in a position to make those types of investments or those kind of priorities in a way that are really going to kind of stand out and say, we're very clear about when we invest in tribal nations or tribal communities, we know exactly what we're doing, but I don't think we're there. I hope that helps.
Yeah, that really, really helps. Thank you. So right now, in my mind, you're our accountability officer, so to speak, kind of the checks and balances. So thank you so much for doing that.
You're welcome.
Mandy?
Yeah, so I do not want to make your work any harder, Sarah. And this came up in another group that I'm doing grants with. I am not comfortable only relying, not only because we have that tribal lens that Buffy's providing us, but mostly relying on scores to make these decisions, because not everyone reviewed them and we all score differently. So I just want to throw that out there, that it makes me uncomfortable that we're doing it that way.
So Mandy, when you're talking specifically about tribal perspective and my tribal lens, can you talk more about that as it relates to my work? Not so much as it relates to the work that the CAC's doing overall, but just my work?
Yes. Well, for me, so I have a couple of different things that I would prioritize. I wouldn't necessarily look at the scores because of those huge differences. If it were solely my decision, I would prioritize the tribes and those organizations that you know are there, are actually communicating with them and providing these services, or are going to provide these services. Another priority would be those trauma-informed services that are going to be provided. Another one would be those services that are providing basic human needs. Because when I think of these social determinants of health, you know, for me, basic human needs, without those, these folks aren't going to be able to work on the other ones. It's not just one social determinant of health. So there's one organization that's in the bottom half of this this spreadsheet that I don't even feel comfortable supporting at all. But obviously I would go with, you know, the group decision. So it's just how my brain works, that there are certain things that I would prioritize instead of using those scores. But I personally would start with those organizations that are partnering or have already communicated with the tribes, because like Teresa mentioned, with those underserved communities, they're at the top of the list for me.
So we have about 35 minutes. We do have deadlines and time constraints, so we do need to make a decision today. I'm wondering if it'd be helpful if we could look at where the funding line is, what's above and below the line, and finesse it just a little bit, given this information, giving other considerations that the CAC has. Kelly, would you mind kind of showing where that line break is? Is there any way to zoom in just a little bit so we can see the titles?
Can I have ask one question or clarification?
Elaine, you muted right as you were talking.
Shoot, I'm having audio issues. Can you hear me?
Yes.
I've been on the CAC a long time, but I still don't feel grounded in, are we supposed to be giving more weight to serving Medicaid OHP? Yes. Yes.
The projects need to serve both OHP and be available for the community. So the projects cannot exclude OHP members, but other members of the community should be able to take advantage of these investments as well. So a good example of a project like last year would be like the Culver pickleball court. Anybody has access to that, or a community class.
So I love volunteers in medicine, but I was confused because they cannot, their mission is to not serve people with insurance. So they cannot serve OHP.
So for that one specifically, I reached out to Kat, and so the dietitians, once they make, so the person that the dietitians make contact with is on OHP. However, once they make that contact with that person, a lot of them have children and spouses that the dietitian will then work with.
Okay, but the main client or patient is not OHP, and you're saying that's okay?
It's okay as long as, because they'll serve the family members that are on OHP, and that would include OHP members.
Okay, and Kristen, you're saying that's fine?
Yeah, because it's more like some of these classes are more like a community setting. So they're not necessarily excluding maybe the children or other family members that might be on OHP. So yeah, I did actually flag that one, and Michaela reached out to Volunteers in Medicine to confirm that the family members may have OHP, and therefore they would also benefit from the nutrition, the cards coming home, any type of food coming home with the volunteer in medicine patient.
Okay, thank you. That's a like.
That was a tough one though. Yeah, there was another one, unfortunately, from Crook County that would exclude OHP altogether, the first responder trainings. And that one, unfortunately, would be excluded from this type of funding.
So what's projected right now, and Kelly, would you expand it just a little bit so we can see what's above Crescent, at least one more? So this is how it's scored without Buffy's adjustments. And so what she was saying, sorry, scroll down, and we'll show you Buffy's score in a sec. So at Boost Oregon, Saving Grace, High Desert Food and Farm would move up above the line. And so Planned Parenthood, Circle of Friends, Dawn's House, and part of Crescent's would move below the line. If you're looking at Buffy's scores, which she can toggle between those two. And it might be easier to go into your email to pull out the spreadsheet separately. And so and you, the CAC, have, full authority to make whatever funding decision you see fit, as long as it falls within the community health project requirements. But what are some kind of gut reactions to what was shared? What are your reactions?
Hi, I had one comment. The first responders, they don't, I think maybe they respond to OHP people. That was confusing to me because they don't know who they're responding to. And am I confused or what?
Yeah, so that
Go
one,
ahead,
the project serves in the wellness programs for those first responders, which, we all want to support the first responders. But since it was a little further removed from serving OHP, that one got flagged as not qualifying.
Well, I'm confused because I'm on the OHP slightly. I earn too much money. I'm on that open card or whatever that pays for almost nothing. Well, I had to go to the hospital this summer, and the first responders and Ben came and took me. And so I'm a little bit confused. Of course, then I got a bill for $1,500. I was like, oh dear, how am I going to pay for this? But I mean, they took care of me just like I was a normal person. They were somewhat confused why I was asking for a response, but I felt like I did in 01, and I thought, oh my gosh, this is when I got sick, and I'm going to the hospital to find out what's going on. And I did have some problems, but there were no really good answers out of it. I did get some medication, and that was good. But I can access first responders. That's what I'm trying to say. Yes, I can, but my insurance is not going to pay for it. Medicare will not pay for first responders. And that's why I got that bill.
So Elizabeth, this is Kristen. So this project would actually be paying for those first responders, some individual first responders to go to like a resilience type training. And then it would also be providing like kind of wellness benefits directly, behavioral health and wellness benefits directly to the first responders. So I totally understand that in turn, those first responders serve everybody regardless of their insurance, but the funding for this project would be directly serving only the first responders.
I guess maybe I can talk to you about that because, I do have COVID. I do have some confusion a little bit today. And I am getting better, but then this confusion came up and I thought, oh, great. So I would like to talk to you a little bit individually. Thank you.
Kristen's nodding her head.
Sure, no problem, thank you.
Okay, so I heard from Mandy earlier. She wants to prioritize tribal applications. What are some other considerations and thought as we look at kind of which projects fall above or below that funding line?
Connor, Stacy, and other folks that did a lot of the reviewing. I'm really love to hear from you all since you were knee deep, nose deep into those applications. And other folks, those of you, I just haven't heard from you too. So I'm super curious what you're thinking.
I appreciate Buffy's efforts in trying to help better provide a lens for us as to who's actually being, working with the tribes. So I really appreciate that.
I agree with Connor as well, especially since we don't have that lens. We do really rely on Buffy, to provide us feedback on what the community needs there and how best to allocate money or not allocate money to that community. And then I do have some concerns with some of the other applications that I can speak to in like Bend, for example. I think specifically one of them was Dawn's House, which after looking at like the website, I noticed they used before and after pictures of mugshots on their slideshow, which that for me didn't sit well. I also am thinking for people who are constantly or consistently seeking COHC funds, and I know that is one of the organizations that does, just because I've seen them pop up quite a bit. So that's another thing that I think about is like, are we seeing the same organizations getting funding? Is there a cap on organizations that receive funding? Is it being utilized in a way that they are going to be sustainable at some point without continuously seeking COHC funding? So those are just some of my thoughts, my concerns, because I think ultimately we would want these organizations to be sustainable and to allow new organizations to seek these funds.
So Stacy, in there, like for this conversation specifically, are you saying, I'm wondering what you're saying with regards to prioritizing organizations that the CAC hasn't funded historically, in a way, differently than those who you've seen before as funding? Like, tell me a little bit more on how your thinking would apply to this decision. Like, what's your preference?
So my thoughts are there organizations that are more sustainable that maybe need that stepping stone that with this money they would be able to then carry on? Is it something where, like Meals on Wheels, obviously that is a very long project. Are they seeking other funding sources to be sustainable that are, maybe more reliable than Community Advisory Council grants? Because I would hope that what we are able to do is provide people with an opportunity to get very delicate resources to populations that are severely underserved, and not continuously funding the same organization over again that has not shown effort in finding other sources of sustainable funds. If that makes more sense.
That's super helpful, Stacy. Thank you around that, because I think what I'm hearing is that wanting to prioritize funding for organizations that haven't sought funding before, so much so, and really those who are prioritizing really focused efforts with some populations. Period. And my other thought is, most of these organizations are nonprofits and they survive on grants. So the Health Council has been, invested in the community, and it's a known entity too, because nonprofits have no other way to fund other than grants, which is this weird, nature of nonprofit work. So thank you for sharing and fleshing that out. I appreciate that, Stacy.
I think part of the process is they are established by grants. They're funded by grants, and they probably put out a lot more applications than just us. But the reason that that's important, that if they're grant funded, then they can serve vulnerable or lower income or middle class, whoever they're serving, people because they're picking up the cost of what they would have to charge the consumer. I mean, I think Seed to Table is a perfect example of that. To meet the needs of those people who can't afford to utilize their service. So, and they get it by subsidizing that with grant applications. And we don't honestly know how many applications they put out there. So that is my viewpoint on that. For me personally, I think being very subjective is unfair to anybody who fills out this application. So I use the scorecard and I put a lot of weight on it. And I applied the same thing because it's pretty clear. You know, is it easy to understand what the project does? I gave a point system to that applied to every application. If it was clear what they were doing, then they would get the total points. If not, it was like, okay, is it not clear at all or kind of clear? And so it would be scored. And I applied that same process to every single, all 73 applications. So I think, in my opinion, that the scoring is critical. And I know that it is really hard to be objective, but I also think you have to have some sort of scoring system to keep you on track. And that's, I think, true of everyone. You have to think of it like grading and your children being graded. Well, you know, maybe the teacher doesn't like them. They shouldn't flunk them, or they really like them, so they get great grades, even though then they don't deserve it. I think it's a real fine line. But I do appreciate Buffy's help and everything else.
I would only argue with that partially because I don't feel like people should be graded on their ability to write a grant, but on what they are doing for the community, because we do have smaller organizations who do not have the bandwidth or the capacity to write a lot of grants, but they could utilize the help, and they do a lot of great work in the community. But if we're going to grade them on their bandwidth and their capacity and their availability to apply for the grant and be well written, even though there are opportunities for help with that, then I would say that we might be excluding a lot of really great organizations. So there is some grants that I've asked for a lot of clarification when I didn't know. I like the idea, but it was like, I need more clarification from them because I don't want to exclude them because maybe their skills are not in writing, but I need something more from them just to make a more informed choice.
All right, so what you folks are seeing on the screen is, this is basically what Buffy's scoring looks like. It would swap out these in gray, so Planned Parenthood, Circle of Friends, Dawn's House, with the Boost Oregon, Saving Grace, High Desert Food and Farm. We have a little over 15 minutes left to make a funding decision.
So to clarify, the three in yellow, based on Buffy's work to verify that they have partnerships with the tribes, those three would move up above the line, and the three in gray would move below the line, because specifically related to the fact that they don't have true partnerships.
So given the points that she added points to the projects that were serving tribal communities that she could verify.
I would suggest that we swap them. Unless, I mean, but open it up for anybody else who feels differently. But move the.
I agree, Brad.
And Crescent would be partially funded.
Okay.
I just want to note that I'm pretty sure that Crescent Community Club project is the only project that directly serves that North Klamath region in the top. Just a note.
In this list, you're talking, Kristen, when you say HOP?
Yeah, like in the top part, that would be, I guess, fully funded. Yeah,
Got
because the other one that would serve the area is further, more gonna potentially be 50% funded.
Thanks.
Yeah, so you could do, you know, fully fund Crescent and then partially fund High Desert, or, you know, a number of different options.
One other question I have that the way it's laid out here at least doesn't necessarily address is we have chosen to prioritize rural organizations serving rural areas.
Mm-hmm.
And so I'm wondering, I guess at the very minimal, at that top section above the 1.9 million, do we have a sense for how many of those are serving outside the Bend area? How many are only in Bend?
We'll scroll up. So COCC, not sure about core. Critical Home Repairs is serving South Deschutes. Not sure about them. Lines for Life is in Warm Springs. Warm Springs Community Action is in Warm Springs. Sri Panya, I believe, is Jefferson, or at least part of their project is at Jefferson. You have Crook, Oasis is in Redmond, Campfire. Those are serving rural communities. Giving Plates in Bend, Bethlehem's in Bend. Seed to Table would serve Warm Springs, I believe. Terrebonne. So a number of them.
So I think that's the only thing that I want to make sure that we're mindful that we're not like overly weighed toward proposals that only serve Bend. Not that Bend is not deserving, but that's a priority that we've made because we believe the Bend, particularly the larger Bend organizations, have more resources, more access to other funding.
Hi, can I make a suggestion? Okay, so I know I'm covering for Carolyn, but would it be possible to fund all 6 of them by providing 50% of the funding instead of a complete 100, since these 6 are being questioned? With that being said, does this application process happen again, like within the following year? Because if so, then that can be another factor that they can put in the application if it's a recurring application. Now, this is my first time, so that's why I'm asking.
So just to clarify, everything below the line, we're looking at funding 50% already through other funds.
Except for the ones that don't qualify, right at the very bottom, you said?
Yeah, correct.
Can you scroll down and just show us again which ones don't qualify?
So just doing a time check, we have about 13 minutes left.
Andy, you had your hand up. Do you have a proposal maybe?
I don't know if it's a proposal. I was just looking at the ones that are going to be switched. And so in looking at the bottom section of the top half, I am focusing on just 2 of them, and it's Circle of Friends and Every Kid Sports. And so I'll start this by saying my kids have used both of these services. So I have experience with both of them. And when I think about what I would personally want for my own children, I would rather see them have a service that helps kids who have trauma than put them in sports. And so that is just something that's kind of where my comment was with the scoring. Like, you know, I don't know. I won't get into it, but.
I'm hearing the prioritization of basic needs, tribal, rural.
And trauma informed. I think that's something that we don't focus on enough.
Mhm.
And we finally have the information available to say that that unresolved trauma is causing all of, not all, a lot of the health conditions that people are dealing with. I just don't think there's enough focus on it. So I'm not saying I don't think sports are important for kids, you know, but you know, they can do music clubs or other, you know, other things. But in just looking at those two, it just hurts my heart that one of those would move down and not the other. And so that is why the focusing on just scoring, you know, there are those other pieces where some of us may have those personal experiences with those organizations that could make a difference. And that's just what I saw in that other group that I was looking to.
So you're
throwing it
saying
out there.
keep circle of friends, move every kid's down.
And I'm not even saying move it. I'm just saying that that's, you know, having that experience with those two organizations, that one of them is going to have a more important impact, I think. And when it obviously depends on the kid too, but I just think that that trauma piece is really, really important.
Okay, and then
Can I,
Pacific Source, Kristen, were you saying that Pacific Source could fund?
It's just a note that we actually are already working with the Smile for Kids to help fund the program. That would fell under the Cannot Fund program because it would be at like an individual level, individual kiddo getting braces. So just so you guys, just a note that we are going to work with them to fund that project so we can help children get orthodontic care that they need, but it just needs to come from a different funding pool because it's member specific.
can I ask Kristen a question on that topic? For Every Kid Plays, could that be a flex funding opportunity?
I've kind of gone back and forth with that. Yeah. I do think that it could be potentially an individual flex fund request.
Because I know schools like in Redmond, I can, you know, they offer 50% or all paid for school activities. And then the Parks and Rec has some scholarships, but I mean, keeping kids active, I just wondered if that could be flex funding opportunity.
Yeah, I think it probably could be for our members. Yeah, I kind of went back and forth on that one a lot. I hate to exclude it because it can benefit children that don't have organ health plan. Like we have been talking a lot about the asset limited income constrained employed folks, and we just sort of received some feedback. And one of the things that they said they feel that their children miss out on the most is extracurricular activities because they can't afford food and soccer. So I think in a way, I guess I'm willing to take the risk that OHA comes back and goes, that could have been flex funds. Yeah.
So how do folks feel about the proposed moving Every Kid's planned in Dawn's house below the line and moving Boost, Saving Grace, and High Desert Food and Farm above?
You maybe use reactions, thumbs up or thumbs down or you could use the ooh face if you want to use the reactions, if you're not so agreeable like this.
And that's based on Buffy's scoring that alters them, correct?
Yeah.
So the results of Buffy's scoring would move up Boost, Saving Grace, and High Desert. And in order to move those up, we'd have to bump some of these down below the line to receive up to 50% of other funding.
I put a thumbs down only because I don't think we should, while I appreciate Mandy's opinion and voice, I don't know if we should kick Every Kid's sport out because it is above Circle of Friends scoring. So I think that would kind of dictate all those who scored every kid's sport above circle of friends, in my opinion. So I would vote the bottom three out instead of picking two of the three and then picking every kid's sport.
Oh, yeah.
Reactions to Connor's suggestion?
I agree. I mean, I think you just flip based on, because if we're based on Buffy's work. And that's the criteria I would stick with. I mean, I do appreciate her opinion too, but I also think we all have experiences at either working with organizations or being one of those people that's gonna jade our, not jade is the wrong word, give us that more knowledge base to work with when we're dealing with different organizational applications.
Elizabeth, Stacy, I'm just going to invite you into the conversation because we're going to have some disagreement and that's okay. But wanted to kind of get a broader feel for about this piece too.
Well, thank you for inviting me. I'm just listening. I kind of agree to move below the line, you know. So Savings Grace is in. Now I want Saving Grace to be 100% funded. I've talked to some people who were there, and the navigators really turned them around.
Mm-hmm.
They lived with abuse like 20 years. Oh my gosh. And the sports thing, somewhere I want that to be funded, but if it can be flex funds,
mm-hmm.
I think that's important, you know? So
Thanks.
I don't know, have those feelings.
Yeah. Thanks. And remember, those above below the line will get partial funding as well. So
I wonder if, like, for example, the Every Kid Sports could be partially funded by the COHC for people who don't have access to flex funding, just as an option. But it's hard. I think the Deschutes County Health Services mobile outreach vehicle is really cool. I don't remember right off the top of my head who it all serves, but if we are looking at specific communities, would that be one we want to partially fund and open up 40,000? Or it's my only thought to make things more complicated.
Is that because you think Deschutes County doesn't have rural areas? I wasn't really sure why that one you suggested.
When I see Deschutes, I'm wondering, are they going to Lapine? Are they going to Sun River? Is it just in Bend? Are they going to Sisters? Are they going to Redmond? I guess I don't remember. I left my big packet at home where specifically they're doing everything at.
So you're going on that prioritizing rural areas.
Yeah, if they are prioritizing the smaller communities in Deschutes, then that's awesome. But I just want to make sure it's not just specific to Bend centric kind of, where we have that conversation quite often.
I opened the application. I'll look real.
I just want to check in.
I was going to say they indicated there in Bend, Lapine, Redmond, Sisters, Sun River, Terrebonne, and Tumalo.
I just want to do a time check with everybody. We're about to hit 1:30. Does everybody have 10 or 15 more minutes so that we're not feeling stressed and rushed? Or are there people that really need to go hard stop? Does anybody need to go hard stop at 1:30? Can we push to 1:45 if we need it?
Brad, this is Miranda. I have to leave in 2 minutes.
Okay.
I think we should just agree whether we're going to follow Buffy's scoring and flip. Either we do it or we don't.
Okay, coming back to Brad's recommendation.
Well, since Miranda, you have a hard stop. Do you want to express kind of where you're at right now?
Yeah, definitely been going back and forth, and I really appreciate everyone's, input and the different sides. I feel like, to kind of be fair, and this is my opinion, that we should swap out the three with the other ones based off the score and Buffy's work. But I also understand Mandy's portion as well. But I think I'll just stick with put the Boost, Oregon, Saving Grace, and High Desert, and move the other three to the bottom.
I'll vote with Miranda.
So Connor's in support of a clean swap.
I'm also in support of a clean swap, and I just want to speak to what Mandy has expressed. It really is difficult because, I mean, that's why you're on it. That's why you serve on a committee, right? To have your voice heard. However, and we have heard you, but I also am kind of uncomfortable with the fact, because we all did the work, or most of us at least did the work. So look at the proposals, not all the proposals, and submit our feedback. And it's just because of the fact that somebody who's absent, could easily have an equally strong opinion about every kid's sports. That's what makes it uncomfortable for me. And so I just think we have to personally prefer to stick with the scoring, and especially because we know we're going to be able to fund it half of Circle of Friends proposal as opposed to zero. So I just want to put that out there.
So are we looking at time? Would the group be comfortable with like a 5-finger vote on Miranda's and Connor's suggestion?
Should we put it in chat so we have a visual of it that's lasting? And can somebody remind us of the 5-finger voting?
Also, if somebody would please restate what we're voting on. Just restate the proposal.
I think it was to approve Boost, Oregon, Saving Grace, and High Desert Food and Farm Alliance into the top, and move Planned Parenthood, Circle of Friends, and Dawn's House into the bottom.
And then the 5 fingers, 5 fully support, 0 is I'm going to oppose it, 3 is I'll live with it. Give you a sense. Oh, there you go. Thanks, Michaela. Elizabeth, I know it's hard. Do you want to just speak your number?
Is someone tallying? I'm not sure.
Okay, I find my computer is just acting up. I support following Buffy's recommendation.
Great.
So, okay,
Thank you. I think that gives us everybody.
Yeah, so the overall vote is to pass this.
Okay.
All right, can everyone live with that?
So there's no 2 1s or 0s, right?
There's no 2 1s or 0s. There's
okay.
Nice job, y'all.
Well, from Pacific Source, yeah, and from Pacific Source, thank you guys so much. This year, I know it was so many applications and just such a huge lift. But it is really exciting to start to see some of the projects that you've already invested in, like take root and start to grow. And so all of the projects were good. And I know it's really hard to make decisions, but we really appreciate your support and help allocating these funds.
Yeah. Here. Y'all are rock stars. It's been a journey, that's for sure.
Thank you, Kristen, for helping.
I'd like to give a hand to all of you too, because they all affected social determinants of health, and they all were valuable, and they all were done by people who really cared. And so I think, you know, it's always the rock and the hard spot. If we were rich, we could make it all work because we have big hearts. But we, you know, have to make those tough decisions. So I applaud you guys. I really think you work well, all of you. So I want to say that before you leave. Bye.
Thanks, Teresa. There's not much else to say. That's yes, 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 and yes. I just have one thing, and if people need to go, we're done, I believe. But the one thing about the 50%, what will our opportunity be to talk about that? Like how these unrestricted COHC funds would cover 50% of all the proposals below the line versus, and I'm just throwing this out there, versus some other use of those funds.
You want me to?
I hate to throw a wrench in it, but
In process of that, Carmen, if she wasn't, if she was available, she could answer. We're looking at that and considering that for sure. So, but it's old monies, so it has less restrictions. It's going to meet a multiple needs when we pursue that. It'll need to come under a different name for, you know, obvious reasons. So we're working through those details, and we'll definitely keep you all informed of that.
Can I ask a clarifying question, Brad? Are you
Yes.
asking essentially like, can you afford this? Is this taking from other projects? Is that what you mean?
I continue to be really concerned about people getting kicked out of their housing with the moratorium coming to an end, the pandemic moratorium ending on September 30th. And I've yet to get any good data on that from anybody, like how many people are facing 72-hour notices. And it's just a nightmare if it's as bad as I think it is, as it could be. And if we got a chunk of money that can help people stay in their homes, that's like the most basic need anybody has, is staying in their home. So it's just something I want to put on the table. Consider.
I want to just jump in and offer a few resources, Brad, and everybody else who's on the call. Pacific Source, for our members, we do have funds available through flex funds to help pay for rent, mortgage, short-term assistance. And then we also gave a big, decent chunk of money to Thrive Central Oregon. And Thrive Central Oregon is able to serve people who are not our CCO members, not our OHP members. So if you do have people that you're working with, or any, that might not qualify for our flexible services because they're not on OHP, I would definitely suggest you reach out to Thrive.
And Thrive probably is connected with neighborhood impact too, neighbor impact, sorry. So, and they have emergency funds too, so.
And this is Carmen, everyone. Sorry if you can hear background noise, but it sounds like, Brad, we need to have a community resource, space to access a lot of the housing needs that will be coming up. So I'd love to work with you to make that happen.
We lost you part in that, but we'll catch you offline.
I heard my name and I'm in.
Thanks, Carmen. All right, thanks everybody. To be continued in November. Good job.